Thank you. Well, did you know that as the summer heat ramps up, your chances of developing a kidney stone goes up as well? Joining us now to explain why this happens and how to properly manage a kidney stone is Dr. John Griffith, a urologist with the Tallwood Urology and Kidney Institute in Plainville. Doctor, welcome.
Thank you. Thank you for having me.
Great to have you. So why does the summer heat increase our chances of developing a kidney stone?
So we all have small minerals within our urine that are typically dissolved within the urine. But unfortunately, in the summer heat, the patients can become dehydrated. And unfortunately, these minerals can precipitate out and form kidney stones. These kidney stones then can start to move through the urinary tract and unfortunately result in significant discomfort. Therefore, now in the summer months, it's even more important than ever for patients to stay well hydrated, particularly if they're prone to forming kidney stones.
All right, what are some of the signs of a stone, and how would someone know if they need to seek treatment?
Absolutely. So typically the pain with kidney stones is described as flank pain, often radiating down towards the groin. It can be associated with nausea, vomiting, blood in the urine. And one of the symptoms that's most concerning is if you have these symptoms and you develop a fever, then we worry a significant infection can develop behind this kidney stone. So it's certainly very important to seek medical care if you develop a fever associated with these symptoms. Otherwise, important to reach out to a urologist, establish care, obtain some imaging to confirm that you are in fact dealing with a stone, and if so, how big it is, and therefore how likely it is to pass on its own with time.
All right, tell us why seeing a urologist is important.
Absolutely. So it's important to first establish a diagnosis of a kidney stone, and then we work with patients to give the stone a chance to pass on its own. And in an ideal world, these stones always would pass on their own, but unfortunately, the world is often far from ideal, so sometimes we do need to go ahead and do a procedure to remove the stone. And these procedures can be non-invasive, they can be minimally invasive procedures, and even some more invasive options are available for larger, more complex stones when necessary. So we deal with that acute stone episode. We assist patients in either passing it on their own or helping them to remove it through a procedure. Then we turn our focus into doing everything in our power to prevent stones from forming again in the future, because any patient who has experienced one kidney stone is certainly very motivated to limit that risk moving forward.
Yeah. All right, finally, Hartford Healthcare has launched the Kidney Stone Center, which you're part of. How will that help patients?
So it's a great program that was developed and we've launched over the last year that really relies on our nurse navigators. They identify patients who have been seen in our various emergency rooms throughout the state of Connecticut and reach out to those patients to coordinate their care. They ensure they're seen by a physician in a timely manner and receive the appropriate care they need. And they're also a resource to answer questions patients may have in regards to their symptoms before and after meeting with the physicians. This allows us to then offer patients a personalized management for their stones, with the ideal outcome being it passes on its own, but otherwise working with them to address the stone, remove it, and then move into prevention, where we can do a metabolic stone workup where we try to identify why patients are forming these stones, and we work closely with our nephrology colleagues to help facilitate that and talk about dietary modifications and medications to limit these stones.
All right, Dr. John Griffith, thanks for joining us.